Pigmented skin lesions are common skin abnormalities that vary in color, shape, and size. While many are benign, some can indicate serious health risks, including skin cancer. Recognizing the different types of pigmented lesions and knowing when to seek medical advice is crucial for early diagnosis and treatment. Pigmented skin lesions are areas on the skin that appear darker due to an accumulation of melanin. These lesions can range from moles and freckles to more complex growths. While many lesions are harmless, certain types may signal underlying health issues, including malignancies. These lesions are classified based on appearance, structure, and cellular composition. Common types of pigmented skin lesions include moles, nevi, freckles, seborrheic keratoses, and age spots, lentiginous, which are generally benign. However, lesions like atypical moles, actinic keratoses, and melanomas warrant closer attention. Distinguishing between benign and potentially dangerous lesions is essential for maintaining skin health and identifying early signs of skin cancer. Moles, or nevi, are usually harmless clusters of melanocytes that may appear brown, black, or skin-colored. They can be flat or raised and are typically uniform in color and shape. However, atypical or dysplastic moles have irregular borders, uneven coloring, and may indicate a higher risk for melanoma. Individuals with numerous atypical moles should monitor them closely with regular dermatologic exams. Freckles and sunspots, lentiginous, are often benign and related to sun exposure. Freckles usually appear in fair-skinned individuals and darken with sunlight, while lentiginous are often age-related. Though these spots are generally harmless, sudden changes or rapid growth should be evaluated to rule out any underlying pathology. Seborrheic keratoses is a common, benign skin growth that appears as a waxy, raised lesion, usually brown or black. Although these lesions are harmless, they can resemble melanoma, causing anxiety. They don't require treatment but can be removed if bothersome or for aesthetic reasons. A dermatologist can help differentiate them from malignant lesions. Actinic keratoses appears as rough, scaly patches on sun-exposed skin, often pink or brown. This lesion is considered precancerous and can develop into squamous cell carcinoma if left untreated. Actinic keratoses serves as a warning sign of cumulative sun damage and should be promptly treated by a dermatologist to prevent progression. Melanoma is a serious form of skin cancer originating in melanocytes, the pigment-producing cells. It can appear as a new mole or change in an existing one. Key warning signs include asymmetry, irregular borders, color variations, diameter larger than 6 mm, and evolution over time, the ABCDE rule. Melanoma can spread quickly, making early detection crucial for effective treatment. Basal cell carcinoma, BCC, and squamous cell carcinoma, SCC, are non-melanoma skin cancers that may appear as pigmented lesions. BCC often presents as a pearly or waxy bump and rarely spreads, while SCC may appear as a scaly patch or ulcerated area that can metastasize if left untreated. Both types are related to sun exposure, with a high success rate if treated early. The ABCDE rule is a guide for identifying potentially malignant lesions: asymmetry, border irregularity, color variation, diameter over 6 mm, and evolution. Any pigmented lesion exhibiting these characteristics should be examined by a dermatologist. Early detection of these signs can significantly improve the prognosis for skin cancers like melanoma. Diagnosis of pigmented skin lesions typically involves visual examination, dermatoscopy, a magnification tool to assess lesion details, and, if necessary, a biopsy. A biopsy allows for microscopic examination to determine if cells are benign or malignant. Regular skin check UPS, especially for individuals with numerous moles or a history of sun exposure, are essential for early diagnosis and intervention. Ignoring changes in pigmented lesions can lead to delayed diagnosis of skin cancers like melanoma, which can be life-threatening if not treated early. Melanoma has a high propensity for spreading to other organs, making early treatment crucial. Other lesions, such as actinic keratoses, may progress to squamous cell carcinoma, highlighting the importance of prompt evaluation. Factors that increase the risk of dangerous pigmented lesions include fair skin, excessive sun exposure, family history of skin cancer, and numerous moles or atypical moles. Genetic conditions, such as familial atypical multiple mole melanoma, FAM, syndrome, further increase melanoma risk. Awareness of these risk factors helps in taking preventive measures and conducting regular skin checks. Preventing problematic pigmented lesions involves diligent sun protection, such as using broad-spectrum sunscreen, wearing protective clothing, and avoiding tanning beds. Regular self-exams and dermatologist visits are essential for catching changes early. Staying vigilant with preventive skincare reduces the risk of sun damage-related lesions like actinic keratoses and melanoma. Treatment varies depending on the lesion type. Benign lesions like moles and freckles often require no intervention, while precancerous lesions, actinic keratoses, may be treated with cryotherapy, topical medications, or laser therapy. Cancerous lesions, such as melanoma, require surgical excision, and in advanced cases, may need chemotherapy or immunotherapy. Early intervention improves treatment outcomes significantly. Did you know that most melanomas appear on areas not commonly exposed to the sun? Also, darker skin tones can still develop melanoma, often on the palms, soles, or under the nails. In recent years, technology like AI and dermatoscopy apps has aided early detection of suspicious lesions, making self-monitoring more accessible. Educating oneself on the signs and risks of pigmented lesions is key to prevention. The fear of cancer associated with pigmented lesions can create significant anxiety. Changes in physical appearance and scars from treatments may also impact self-esteem, especially for lesions on visible areas. Support groups and counseling can help individuals cope with the psychological impact of diagnosis and treatment, encouraging proactive care and follow-up. Pigmented skin lesions can range from harmless to potentially life-threatening. Awareness of the types, risk factors, and warning signs of these lesions is vital for early detection and effective treatment. Regular self-examinations, sun protection, and dermatologist consultations are the best defenses against serious skin conditions, enabling early intervention when necessary. Thank you for learning about the importance of monitoring pigmented skin lesions. By staying informed and proactive, you can take essential steps toward maintaining skin health and reducing the risk of serious conditions.